Now, as we near the end of 2020, I am filled with gratitude for our listener support of the show. It is truly an honor to have so many amazing guests, and you continue to embrace them all. Thank you again for being on this journey with me. So for our listeners of the Prostate Health Podcast, I've prepared a free mini webinar where I discuss my top 3 tips to promote a man's prostate health, but also longevity and quality of life. To access the webinar, all you need to do is go to www.prostatehealthpodcast.com/men's health to check it out. And we'll also be posting this link in the show notes. So again, for those listeners that are serious about improving their prostate health, go to www.prostatehealthpodcast.com/men's health to join me for the free webinar for my top 3 tips in promoting a man's prostate health. So one of our most popular episodes for 2020 was episode number 3, Benign Enlargement of the Prostate. How can a little gland cause so much trouble, with Dr. Ryan Terlecki? And for this week's episode, we'll be having an encore where we are replaying episode 3 today. So stay tuned. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pohlman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. I'm very excited to be able to sit down and chat today with Dr. Ryan Terlecki, urologist at Wake Forest Baptist Health. Dr. Terlecki wears many hats, including Director of the Men's Health Clinic, Director of Medical Student Education, but also Fellowship Director for Reconstructive Health. Dr. Terlecki, welcome to the show.
Thank you. Thank you. Happy to be here.
Dr. Terlecki, today we are focusing in on BPH, or an enlarged prostate. So for our listeners, what does it mean to have an enlarged prostate?
You know, it's interesting. When you and I went through training, even the terminology has changed. But to have an enlarged prostate, what we're typically discussing are symptoms related to the inner portion of the prostate, essentially exerting pressure and weakening a man's ability to urinate. Sometimes patients will come in and say, my doctor told me I had an enlarged prostate on the basis of a digital rectal exam. But if they have no symptoms, that's a little bit separate than what we're talking about today.
Now, can this really interfere then with their normal urination with this enlargement?
It can. The prostate is one of the few organs in the human body that continues to grow throughout life. And as it does, it increases the number of cells. And if you have an imbalance, it can exert pressure on the first part of the plumbing, if you will, when urine leaves the bladder. And as such, the stream can get weaker. It can take longer to empty. It can result in changes to the bladder itself that can be detrimental. And so sometimes men can even develop overactive bladder symptoms similar to what we see advertised by pharmaceutical companies. And those changes aren't unique to men. Women will see those changes as well, but due to other conditions. So yes, it can have a significant impact on their day-to-day routine and their quality of life.
Now, is this a pretty common condition for men?
It is. And so, you know, when you look at prostate biopsies, for example, or if someone has a procedure, you'll see benign cells. It's not necessarily the same thing as saying they have the condition of clinically enlarged prostate that's interfering with urination. But if you look at men in their 50s, at least 1 in 5 is going to have changes suggestive of BPH. Now, as you get up to our 80-year-olds, it's going to be the majority of them. So it is a linear increase as men age throughout life.
So are there any risk factors for men getting this condition?
Well, age itself, of course, is a risk factor. We discuss a little bit of data on family history, and one of the things that we've also noted is that as men lose weight, so those men in the obese population, they can actually see improvement in some of their lower urinary tract symptoms. So it suggests that, body composition might be relevant as well.
One of the big questions I get, men start having these symptoms, immediately they think, wow, could this be cancer? Mm-hmm. Does this necessarily, these guys are having these symptoms, does this mean that they have cancer?
It's interesting. If you go back in time, before we had the luxury of PSA screening, then men would present with prostate cancer in much more advanced stages. And in that setting, yeah, they might be more likely to have associated urinary symptoms suggestive of their cancer. These days, we're finding cancer so early with PSA screening that it's pretty rare that urinary symptoms would be due to a prostate cancer. You could see urinary symptoms more suggestive of bladder cancer, but that's a totally separate discussion. I will tell you that because prostate cancer is so common, occasionally you'll see men with BPH and symptoms and that are found to have cancer, and sometimes they assume that the two are related when they can be entirely separate.
I think you kind of touched on this just a little bit. So the bladder is working against the prostate. So it's working against an obstruction. Mm-hmm. So the bladder is potentially having to work harder.
Yes.
Are there some consequences from that bladder having to work harder against that prostate?
Yeah, it's interesting. If you think about exercise, if you start to work harder and with other muscles in your body, they tend to get stronger, right? And so that's not true with the bladder. So the bladder has a muscle around the outside, and as it tends to have to work harder to expel the urine, it starts to build up scar tissue within the wall of the bladder. So if you look inside the bladder, you'll sometimes see these ridges or maybe little outpouchings that have exposed weak spots in the wall. And so eventually, if this is left unchecked for too long, you can get a bladder that doesn't contract very well at all. And you can see how that would pose problems for a man that's affected by this condition.
So what really should a man expect as part of his initial testing for BPH, say whether he's going to his primary care provider or even a urologist?
I think if a man comes in complaining of urinary symptoms, the first place to start, as with anything, is to take a detailed history, ask the right questions, do an appropriate physical exam. From a baseline testing perspective, urinalysis is essentially routine. If you're in the setting of a urologist's office, they may actually ask you to come in with a full bladder and do what's called a urine flow assessment. So you can walk to the restroom. Occasionally you'll see a funnel type device, and it's measuring the amount of fluid that's coming through as a product of time. And it can generate a flow curve, and you can compare this to what are considered to be normal ranges. And then after that, you go back to the examination room, and in many situations, at least within urology, you can see a bedside ultrasound, what we call a bladder scanner, that can give us an estimate of how much fluid is still within the urinary bladder.
So are there any other conditions that a urologist would need to rule out that may mimic some of these symptoms of an enlarged prostate, or what are some of the other conditions that, in going through taking that history, doing some of these tests, that we'd also want to make sure that we're not missing?
Yeah, so the way I would approach this is I would think of it as the pump and the plumbing. The pump being the bladder, okay? And then the plumbing being everything that allows the passage of urine to reach the outside world. The prostate surrounds the first part of that plumbing. So if you think about from an automotive analogy, so you have a water pump, you have hosing that's leading away from it. The prostate's almost like a hose clamp around it. And if it's too large, as if it's too tight and restricting flow. But you can have scar tissue in the urethra itself. So in the plumbing that's past that point, we refer to those as urethral strictures. So from an analogy perspective, you could think about corrosion on the inside of that plumbing. Now, if the bladder's just weak, and it can be weak from having to fight the prostate, so to speak, for a prolonged period of time, or other conditions. People that have had strokes or neurologic disease might have weak bladders that don't empty fully. And so some people might even have what's called pelvic floor dysfunction, where the muscles in the lower part of their pelvis are very tight and have a high resting tone, and they're unable to relax to initiate their urinary stream. And as I mentioned before, the overactive bladder symptoms may be a product of prolonged, untreated enlargement of the prostate.
So there is certainly a lot to learn about benign enlargement of the prostate. On some of our later episodes, we'll get into more of the treatment aspects of BPH. Dr. Terlecki, thank you again for joining us today on the Prostate Health Podcast. So concluding, any parting advice for our listeners who currently have some of these symptoms we discussed today on the show?
We're now in the 21st century, and we have amazing treatment modalities available. And so what I would say is, if you are planning your day-to-day routine around bathroom locations and tolerating having to get up numerous times a night, or straining to urinate, or concerned about, hygiene issues, or urine leaving the body at inappropriate times, get in to see your doctor, and if necessary, get over to see a urologist, and we'd be happy to see you.
Well, thank you again.
Thank you.
Thanks again for joining us today on the Prostate Health Podcast. Now, do you have an upcoming appointment at the urologist office? Maybe you're scheduled for a biopsy of your prostate, or just received the news that your biopsy was positive for prostate cancer, and now have an upcoming consultation to discuss options with your urologist. You may be wondering, how should I prepare for these appointments, and what should I expect? Well, I've partnered with the Prostate Health Academy to create a free What to Expect guide that will help get you up to speed as you prepare for your visits. This guide includes checklists of what you need to bring and how to prepare. This guide includes what to expect with 3 different scenarios, including your initial urology clinic appointment, a prostate biopsy, and prostate cancer consultation. To receive this free guide, simply go to www.prostatehealthpodcast.com/clinic. Again, that's www.prostatehealthpodcast.com/clinic, or you can find the link on our podcast website at prostatehealthpodcast.com. I want to thank you again for joining me here at the Prostate Health Podcast. Subscribe to the show on iTunes, Google Play, Spotify, or wherever you listen to podcasts. And please share it with a friend who may find this podcast helpful. We'll see you at the next episode.